killed today? How many people have you 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 killed today?
Nobody out! 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 Liar! Liar! Private Kaiser! Private Kaiser! Private Kaiser! Private Kaiser! Private Kaiser! Private Kaiser!
And whenever he can, we're going to have a quick chat here with Andy, who's helping me present today, who happens to be up in Canada. So he's going to talk a little bit about the Canadian system whenever we can get him up here, fill that gap before we have some speakers to bring you.
Hey,
Hello
Luke.
there, Andy.
How are you? Can you hear me okay?
I can hear you good. I can hear you good. I'm sure you've been scrambling.
Well, if the Medicare for All March was an omelet, it would be the world's biggest. Let's just put it that way. Yeah, we just a little quick backstory. We have plans, of course, to go to camping. My wife and I, when this is done today, and we have some just to kind of get away and go over camping. And we have friends. It's not really camping. It's more like glamping. We're going out to a friend's place in the backyard and staying in our trailer because it's the least path of least resistance right now, because not only did my wife shatter her wrist and need 3-hour operation about 4 weeks ago, but since then her and I both got COVID, and we're starting to try to come back from that. And I don't why is that relevant? Well, I do want people to feel sorry for me, obviously, but the reason I bring that up is because of the country that I live in. Neither of those two events cost my wife any money.
Yeah.
And I can just imagine the my wife's her wrist injury. It was just a slip on a slippery mat, and she went down on her wrist and shattered 5 bones. Required 3 hours of surgery to install 2 steel plates, a compression screw, and a number of different other screws. And I can just imagine how much that would have cost if I had been an American. And
yeah.
So,
as imperfect as the Canadian system is in a number of ways, and we could get into that at length with the pharmacare issues and things like that.
Sure.
There is a clear distinction there, and in the United States, we seem to decide that COVID-related care should be free and made it largely free, but we have left everybody else out to dry. If you're a diabetic, if you have cancer, if you have a heart condition, if you have any other health issue, you've been largely left out to dry. So while there are a lot of imperfections in the Canadian system, Andy, can you just talk a little bit about the difference? In Canada, when something happens to you, you get hurt or you get sick, what kind of anxiety does an American face there that you do not have to deal with at all in Canada? Can you just walk us through what that process is like when something comes up in your life?
Well, absolutely. And I do want to preface just quickly, because I think that there's a real disconnect when we talk about any of the healthcare systems and the pandemic that, and I'm not going to say that we went through, I'm going to say that we're currently in, as much as mainstream media would like us to believe that they're not. My wife and I, of course, being prime examples of that. Sorry, just give me a second.
You say as you cough, oh boy.
Yeah.
Too perfect.
Yeah, but we're, of course, going through what a lot of different countries are going through, and most of the pushback is certainly on vaccines or shutting down and the current situations that we have. Is any of the mandates of keeping people locked in their homes or social distancing or masking? The main disconnect that I can see is that those rules are in place primarily to protect what healthcare system you have, right? We've seen that through subsequent through the different viruses since we went through from A to we're currently in Omicron now, that the effects of them have seemed to lessen, and people are just saying that we need to to open back up, but people are still getting sick and they're still requiring attention. Our hospitals in Canada are in a shambles, because we've had so many people that of retirement age that would have stayed, that retired when this hit for self-preservation reasons or whatever their own personal reasons are. We've had people that have not been able to take any time off because they're so badly needed, because our hospitals have been inundated with people. And for example, this time that my wife is off because of her wrist is really the first time off she's had in 3 years since the pandemic started, and they're exhausted. And on top of everything, and this is just a small anecdotal story, our Ontario provincial government, which basically runs the healthcare system, they don't necessarily pay for the healthcare system. That's
right, but provinces
comes from the federal
government.
government.
I know exactly what you mean. Yeah.
But they voted, the Ontario government voted to freeze the wages of all the healthcare professionals when the pandemic started, and they also waived their contract rights so that the hospitals could do whatever they wanted with their employees. And that has never been reinstated. We still don't have contractual protections, and they haven't received really any significant raise at all, while we're in the worst healthcare professional shortage in the history of our country anyways, and probably around the world when you look at the different systems. We need to protect our healthcare systems. We need to protect our professionals. When Deb went with a shattered wrist, she basically sat in a chair in the waiting room and in the emergency room for 6.5 hours like this, holding her shattered wrist in excruciating pain, while the few people that they had working that night went through the list.
This actually, Andy, this gets at a bigger problem, I think. I mean, I think everyone kind of understands global pandemic is, even in a very well-run healthcare system, going to throw some wrenches into this, right? But I think this actually speaks to a broader problem where even single-payer systems will be attacked for having long wait times or these kinds of things, right? And to me, I've always thought, well, that's not an attack on single-payer. That's an attack on that program not having enough resources. Right?
Exactly.
That doesn't actually prove that the system itself is faulty. What that proves is you have not trained enough people, you have not educated enough people, you have not built enough facilities, you have not put enough funding into this program. Can you talk a little bit about how some of the attacks on the Canadian system or the British system or any others really aren't actually attacks on the system itself?
Right, right. But and I think that one of the biggest things that we have to remember, as much as we see that the United States is really the only industrialized country in the world that doesn't have a universal healthcare system. The problem is the countries that do are still neoliberal regimes, right? They're still driven by profit. It's just that the people, wouldn't stand for the fact that they didn't get health care, and they were brought into existence at a time when we weren't as profit-driven and nth-stage capitalism as we are now. And I think that's the American politicians are so bought and paid for now that it's the pharmaceutical industry, it's the large corporations that are calling the shots. So, the American government, I've said this a number of times, the American government is working exactly the way it was designed to work. It is doing the bidding of the people that put them in power. The problem is that the American people did not put these politicians in power. It's the corporations and it's the oligarch class that did that. So they're doing their bidding, right? It's set up and designed to work exactly that way, and people shouldn't be surprised by that.
Yeah,
right?
How
do you change that?
Wasn't it Princeton that did that famous study, or Yale, or one of those fucking schools that did the famous study where they came back and said, actually the United States 99% resembles an oligarchy and 1% or something resembles a democracy, or whatever it was. They found that essentially over 90% of policy was directed exactly at that donor class. So that's not even hyperbolic what you just said there. We do have a literal oligarchy. That is the results of our political system resemble an oligarchy. I've mentioned a number of times throughout these various broadcasts that I think we are at a point where we've won the public argument, right? When you have 75-80% of people consistently polling in favor of your position, you've won the public argument. So what do we do here to actually get this thing implemented? I mean, what is it that's the actual hurdle between us and Medicare for All? It's clearly not convincing the public, right?
Well, it's how do you get the information out, right? Because there's still the vast majority of the electoral group of Americans that do the majority of electing of the politicians still get their information from the corporately tainted mainstream media. And a prime example of that was when the Florida primary between Joe Biden and Bernie Sanders, and the poll question, who is better on Medicare for all? And that was, the majority said Joe Biden, right? It's the information. We have to somehow get information to people, and this is at least the way to start.